So you're going to turn the audio recorder on first? Are you?
Ah,
And the camera's going?
it's going, it's
Oh,
on.
all right. My name is Karen Hill, and I'm in Toronto. Today is the 24th of May, 1984. This is the Oral History of Social Work in Canada project of Canadian Association of Social Workers. Today I'm interviewing Mr. Walter Lyons. Mr. Lyons, in order to begin, I wonder if you might tell us when and where you were born, and a little bit about your early background.
In Hamilton, 1917. Means that when I was a teenager, hit the Depression. So, brought up in a middle-class family. It was survived, but hit hard by the Depression.
Mm-hmm.
And went to high school, and by that time, all kinds of things were going on in this world during the Depression, and the preparations for war, the dangers of war, Hitler, Spanish Revolution, which had a big impact on me.
Mm-hmm.
Because by that time I was more politically conscious. You had to be politically conscious during the Depression. There were so many social events going on. I remember at camp, one of the few times I went to camp, the marchers from the unemployed who marched on Ottawa, you might have heard of that,
Mm-hmm.
stopped overnight at the camp that we were at outside of Toronto. And talking with them and learning what was going on had a big impact on me. Helped to raise my social consciousness. And influenced, I think, some of the things like that influenced me in going into social work.
Mm-hmm.
Young people want to help. They have more idealistic ideas, and so did I. And my sister got some training in social work in Buffalo and was the first Jewish social worker in the Jewish Communal Services in Hamilton. I didn't know too much of what she did, and I really don't think that was sort of a model I was following. It was much more the social influences, wanting to engage in something which would be helpful to society. And the problems of society were very evident. One of my close friends in high school came from a family that was unemployed. They were living on relief. He was a very brilliant student, much smarter than I was, and a very bitter person, young person too, because of the deprivations that they were going through and the terrible contradictions in society, which, if you wanted to open up your eyes, were very evident then, and if you want to open up your eyes, are still evident today.
Mm-hmm.
And we used to exchange all kinds of discussions in literature. Some of it was radical literature, some of it not, but I was a reader and got interested in politics and felt I never saw social workers changing the world.
Mr. Lynch, you say you never saw it, the social workers. Do you mean that you didn't observe that, or you didn't foresee that?
It's very hard in going back to have accurate recall of exactly what you felt a long time ago. But if you felt you could do something useful, people needed help, and there were some concrete things you could do, and that there were concrete social measures that could be taken to relieve suffering. That's what I was more interested in. So, but I don't think I had a larger view of transforming humanity or anything like that out of social work. Indeed, you know, as I got into social work later on, there were things that I read from 1921, the National Conference of Social Work in the States, the proceedings, which would be very interesting to go back to. There were many radicals in social work who had a very a perspective of what this world was about, which was much more attuned to socialism today than our social workers would be. Feeling that the major changes were not going to be brought about by social work, but were going to be brought about by other political decisions that were outside of the realm, and that social workers should help to bring them about, but it wasn't going to be, the world wasn't going to be transformed by social work. But people could be helped by social work, and there were social measures that they should take, and they should not be confined in their interests to just the worker-client relationship, but they had to be concerned about social conditions. I think during the 60s, young people thought that they were discovering something. This had been a very strong tradition, and most articulately expressed much earlier than that, in the 1920s. Bertha Reynolds, if you remember her.
That's exactly who I was thinking about.
Sure. And some of her, I think there was a speech in 1922 or something, the National Conference on Social Work somewhere in the States, was really quite a social statement. Putting that in perspective. And she published a newsletter, as you may be aware, which was meant to be like an alternative publication in social work that was really pushing much more broad social view of what needed to be done. And I think that was important because, again, you have to place that against what was happening in social work in those times, because you have to go back to Mary Richmond and the looking at the environment and the social supports that there were for people that would make things different. And then the huge interest as the profession began to develop as a profession, as they began to move toward academia and wanted to absorb studies in economics and psychology and psychoanalysis. And looking at what happened to the individual as being reactive to outside circumstances began also to shift at the time that, by the time I began my training in social work, it had begun to shift already to an interest in what was happening inside the individual as being important to account for what was happening, and that this was grabbed onto by social workers, I think with some very logical reasons, part of it being the background that social workers came from, which would make them more interested in that. Also some frustrations as to what resources they had to bring to deal with social problems that they contended with. So dealing with the individual put it much more in the person's control. If you didn't have the resources that you could count upon, and the individual social worker couldn't command all kinds of resources, it depended upon what the agency would provide and what the community would provide. At least here was something that you could do directly with people. And so there was a big interest and a big swing in that regard. And that was happening at the time that I was beginning my training.
When was it that you started your social work education?
Actually, in 1941.
And where did you go to school?
University of Toronto.
Why did you decide to go to U of T rather than Buffalo, where your sister had gone?
Well, first of all, because going to Buffalo, I never even thought of it because it was economically out of the question. I almost did get to the School of Social Workers. It was only because of my dentist that I did.
Oh, what did your dentist have to do with it?
Well, he'd been following me and my twin brothers and what we were doing from the time we were little kids, and kept asking us. One of the questions he always asked us was, well, what, what, I always started off the conversation, well, what's going to happen with you? What are you going to do? And when I went through McMaster University and got my BA, and I told, he knew of my interest in social work, but I didn't go to social work from McMaster. I went to work because I didn't have any money. I didn't have any money to support myself. And when he heard that I wasn't, he knew I was going to work, but when he found out I didn't have any money to go, I couldn't save up enough money on what I was earning, he was upset. And actually it was right at the very beginning of the school term. So he said, no, you've got to go immediately. And so he called an uncle of mine, and they got together and said, here's the money. As a matter of fact, he got me on the telephone. I couldn't afford a long distance call to the University of Toronto to ask whether they would, if they would accept me or consider an application. So I began a little bit late, about 2 weeks late. Yeah,
Through the good
that's,
offices of your
yeah,
dentist.
yeah, but that's how I did it. I didn't have enough money. My parents didn't have enough money to send me.
Yeah, yeah.
So-
When you went to the University of Toronto, do you have a recollection about the kinds of courses that you had?
Yes, we had Charlotte Whitten talk to us about the development of welfare system across Canada. Stuart Jaffrey was the dean. Barbara Finlayson was one of my teachers in casework. We had a fellow teaching group work who really didn't know very much about group work. I don't think the school at that time was that strong in good professional practice. Because it was after I graduated and worked. I graduated and went to Winnipeg and worked with the provincial government there in the Child Welfare Division. And after I had 1 year of experience, the Manitoba School was looking for a student supervisor, and K.O. McKenzie was the director of the department at that time, and recommended me as a student supervisor, and of course, why not? But already in my practice, working with children and in protection cases and adoption, around which I really knew nothing. Really very unprepared for these kinds of things. But that's the best they had to offer. I was considered quite well trained because I completed 2 years in the School of Social Work, and most of the workers had not. They had practical life experience, came from a number of different places, were very dedicated, and I think knew more than I did. I knew some theory, and not that good theory at that. But it was the kinds of very basic questions a student will ask, which fed into my own concerns about what I knew, and caused me to seek other education, additional education.
And so did you go on and then and
Yes, there were, at that time too, I met Sophie, who was to be my wife, and she had preceded me through the University of Toronto School of Social Work, and had decided to go to the Pennsylvania School of Social Work. And there were a coincidence that occurred. My meeting of her, and also meeting a graduate of the school who came and gave a lecture to us at the department, child welfare department. I guess that included mother's allowance as well. Mother's Lawn was a branch of the department. But I remember her talking about supervision. And there was a clarity that she brought, a way of looking at the whole question of supervision, which I had never even entered my mind and impressed me no end. And I asked her where this was taught and where she got it. And she was a graduate of the Pennsylvania School of Social Work at that time, and told me about things about the currents in social work about which I knew nothing, and the conflicts that were going on between the functional and diagnostic schools. The diagnostic being the way of describing, I guess, a more Freudian approach to the individual. And the functional, which today people know of, but don't understand, even today. I find that over and over again.
I don't know what the functional school of thought is.
No, most people don't. Some who dismiss it too, which I
Yeah.
found out from talking to faculty in social work who think they do, but they don't. They don't understand it.
Well, at that time, this would have been in the mid-40s, would it?
This
When
was in
Pennsylvania?
1942. That's right. 42 and 43 is when I stayed in Manitoba. Sorry, I've got the dates wrong. I graduated in 43. This would have been in 44 and 45.
And those were the years that you worked in Manitoba.
That's right.
Okay, so at the time that this questioning and thinking was going on in your mind about the difference between diagnostic and functional schools of thought, what was it defined? What was
No,
the
I
functional
want
thought?
to correct something.
Mhm.
That wasn't going on in my mind. That was going on in the field, and went on in the field for some time. I wasn't even aware of it until Rose Green told me of it, and I didn't understand it.
She was a lady from Pennsylvania.
That's right. And then my wife, whom I had met in Winnipeg, although she worked in Toronto, but her home was in Winnipeg, and that's where I met her, went to the Pennsylvania School of Social Work to the advanced curriculum. And I read her thesis, which impressed me no end, because it was she'd worked in the Children's Agency in Philadelphia. And again, there seemed to be an understanding and a clarity about what and why you were doing what you were doing, which was important. And so I decided that that's what I wanted to do. And at the same time wanted to get married to Sophie.
Right.
She accepted. So she had a job back in Philadelphia, and I was going to go to school in Philadelphia. And the Philadelphia school was, at that time, not what it is today, it's changed a good deal, had 3 geniuses there. They really were Jessie Taft, Virginia Robinson, and Kenneth Prey. Great names that people might have heard as great names, but how well they really understood their contributions is another thing. I think some of that has been lost. And I approached the school. The school was unusual and extremely, very different from what I know of schools of social work today, and certainly from what I went through at the University of Toronto, in that they believed and understood enough of what they were doing to apply it to the whole teaching and learning situation. So that they understood that when you were coming to the School of Social Work, you were asking them for help. You wanted to get skill. You wanted to learn something. And they knew from their experience what it took to learn what they had to teach, because they were very clear about what they wanted, what they felt was helping and the way to help. What it took by way of the student's application, what the student had to bring to it, and how much the student could absorb in a school year. So they took responsibility for that. It wasn't just open-ended and saying, well, you get as much as you want, or you'll start off at a different point. You felt right away they were dedicated. If they were going to take you in, they were going to work just as hard as you to make sure that you got what was there to get. And if you weren't starting off at the right point, they weren't going to mislead you by saying, well, you'll try. So I came, and I really didn't know enough about what I knew. I wanted something else, but I didn't know what I was doing. I mean, I didn't know what it was they were offering, and I just got married too, or was going to be married when I applied. Already was engaged, and I met Jesse Taft. They asked you to prepare something in writing, and I prepared something in writing. And they could see right through me, like just as a matter of fact, that was one of the things that aroused some anger, because they understood you sometimes much better than you understood yourself. And well, that sometimes happens in a helping situation, and the anger that comes out is part of what the learning and the helping is all about. So no, she told me to scram. No way, I didn't know what I was doing, and she wasn't going to allow me into the school. And because I really didn't understand what I was doing. The point was that she was dead right, absolutely dead on. Would have been disastrous, because I had decided that out of my experience in working in child welfare, that I really didn't know very much. And the truth was I didn't. But my approach was, well, wipe the slate clean, start off from scratch, and relearn. Well, you can't do that. You got to build upon what you know. You got to find out. You got to use something about you. So she said, "Look, why don't you go to an agency that practices our way of helping, and then you'll see much more what it's about." And then the idea of coming back, well, if you ever want to, that's something else. We'll look at it at that time. And I did. I did get a job at Jewish Family and Service in Philadelphia with an excellent supervisor. And the crisis that I would have had in school occurred at work. I had pushed everything out. I started off knowing nothing, and gradually got paralyzed. Couldn't function. And there I was, newly married, wanting to have a career, and so be able to earn enough money. And I had to face the crisis of facing that, well, maybe I couldn't be a social worker. And reaching that decision was, finally came home and told Sophie that I was resigning from the agency, and I was going to go back and sell clothing, which I had done to try to make a living. My father had been in that kind of a business. And I experienced the greatest release and sense of euphoria that I've ever experienced in my life, because I was out of a trap. I had trapped myself, and by the way I had structured things, that I didn't know anything, and I was going to relearn everything without rescuing what I had to put into that situation. So when I decided I was going to resign and that at least I could be a clothing salesman, at least that was the first piece of affirmation, and that released me. And I went back and I resigned, and I got busy and commenced to work with my clients who I'd never worked with before to try to end up, and I did work like I'd never worked before. And then I fought my way back into the Pennsylvania School of Social Work on the basis of what I had done, not on the basis of what I wanted, but on the basis of demonstration that I was beginning to take hold. And that was the best thing that ever happened to me, because that was a fantastic learning experience, the like of which I've been seeing students, you don't get it again, because they weren't interested in, see, it's important that you understand what was happening in social work and what was happening to schools of social work. When I went to the University of Toronto, and this has bearing upon what was different about Pennsylvania and about what some of what has been lacking in social work today. Social work, began with agencies practicing, and then turning to universities. As you know, was the first schools of social work turned to universities to try to get more information about economics, about psychology, about all the things that they thought would help them as practitioners. And practitioners were the main faculty in social work, bringing in other things from other faculties to lecture and to add. You know, they brought in psychiatrists and they brought in economists and so forth. That was what was going on in the University of Toronto. But practitioners were some of the chief faculty. Well, the University of Toronto at that time didn't give an MSW. It gave a diploma in social science. And in order to get recognition from the School of Graduate Studies, there was a lot of pressure upon schools. Dr. Jaffrey had a PhD that was critically important. That had standing. And the importance was placed upon getting faculty who had academic standing. The School of Graduate Studies says, well, where is your research? Where are your doctorates? Where's your academic standing? If you're going to have standing in this academic setting, why you have to bring in people with academic qualifications. And there was a big push upon that. And bringing in people who were not practitioners but were academics influenced the whole teaching in social work a great deal. More and more, there was more and more push upon, the economists wanted the person to understand much more about economics, and the people wanted to understand more about the history of social welfare. Every academic person wanted to have could think of all the vast areas of knowledge which a student should have as background. Who was related to practice? Who was taking responsibility for what that student was going to meet when he walked out and really looked at that client? Okay. And what happened was going on in faculties of social work was that kind of clash. I know because when I came back and we had field practice, we looked and valued for the people in the School of Social Work who were really able to relate to what the practice situation was, and valued students who would get hooked into the practice situation and not just show academic brilliance. You don't necessarily make good social workers.
Sure,
You make good researchers, but not necessarily good helpers.
So how was it different then from what you saw at Pennsylvania?
So what happened in Pennsylvania was very different in that they were geared to giving you a skill that you had to demonstrate. You had to demonstrate it in practice with clients before you got out. And they knew that there was only so much that you could take in, and that you had to absorb so much, and you had to do so many things, you had to learn so many things in order to do that. So they confined the curriculum. Now, this was true. This was the advanced curriculum. They call it the advanced curriculum for people who already had a degree in social work. And there were many of the top figures in social work who went through that program and came out, who made real contributions in social work thinking out of that curriculum. But it was very different in that it was very geared and integrated to practice, so that you had one course in practice. And that practice was based upon the student's practice. They started off with one prepared piece of material, and after that it was student material that was worked on. And out of that, you had to get related to what was the function, what was that agency there to do? Why did that client come to that agency? He didn't come because they were interested in the social worker. I mean, frankly, clients don't give a damn, and neither should they, about it's what service can that person give to them. And the fact that they were looking at how did that social worker use that socially sanctioned function, that job that they were there to do, to help the person who came to them. And they understood that process very well. That's what the whole functional school developed from. I'm not just, don't think that those few words describe what is functional social work. Please, it doesn't, but just trying to pin it down. So that they had one course in practice, and one course, and that was, the practice one was by Jesse Taft, who had really developed this whole approach to social work,
Mhm.
to the helping in social work, not to social work, but to the helping process in social work.
Mhm.
The next course was on the development of the self, the growth of the person, understanding the growth of the person, taught by Virginia Robinson.
I've read her book by that title.
Yeah,
Yeah.
and she did book on supervision and so forth. That
Mhm.
really began to turn around the whole look at supervision.
Mhm.
Well, the development of the self again was directed at you.
Mhm.
What did you understand, and how? What was your growth and development? Because you're not going to understand if you think you're going to understand things by not relating them to you. And if you can't see yourself in some of these situations, you really don't understand. You think you understand. You know about, but you don't understand it.
Mhm.
You know about a great many things up in the head, but you really don't understand it. You don't
Mhm.
integrate it. So that a lot of it was related, again, to what you understood, what you could grasp, and what you could relate to, and relate to out of your own experience. So you read books, and you had to look at personality development, and they could see what you were doing, both in your casework and your class. You had an assignment, 2 assignments every week.
Mhm.
Every week, one in the practice and one in the development of the self.
Mhm.
And they could see by what you were writing,
Mhm.
what you were grasping and what you were not grasping. Bang, there was notes. Every assignment had a note about what it was, and if they saw you were in difficulty, there was a note on the board. Come, they just give you an appointment and you came. And they
Mhm.
were there to work with you and help you get related and to use the material to cotton on to what you weren't cottoning on to.
Okay. At the same time you were having the classes, were you doing a field placement at the same time so you could sort of
Most
test
of it
these?
was field placement. One
Mhm.
day of classes and 4 days of field work. 1 day of class and 4 day of field work.
That's almost the reverse proportion from many
Absolutely,
schools.
absolutely.
Mhm.
So that, and there was no such thing as, there wasn't any such thing. You didn't have time, no such thing as a late assignment. I mean, it wasn't that they couldn't, they were used every assignment in the class. Back in the class, they would quote from the things without identifying the student to illustrate points and help you to learn. And therefore, your assignment was critical to the classwork.
Mhm.
So if you had a problem with a late assignment, you were obviously having difficulty with coping with the course, and they would either deal and you would either cope or out. And that's why they chose people knowingly. They chose people knowingly, very carefully. Very few people, well, some people realized it wasn't for them, but there weren't that many. Very few, because they also kept the class to the size that they could cope with.
Mhm.
It wasn't, again, you see in academia, you get the whole business of, well, the economic pressures, what is the cost per student, and why can't why can't you use audiovisual aids to teach a group this, and why can't you practice that? What happens is that the individual responsibility, the student goes into the School of Social Work wanting to get skill. They want skill. The school says, we're going to give it to you. How much individual responsibility is taken? I mean, how much responsibility is taken for the individual? Does the
Mhm.
school really make sure that that individual is going to get what they're after, or can get what they're after, that their sights are right in the first place, and so that the student is geared in the right way, and is the school going to see them through? Sometimes that can get lost between different, there's a faculty advisor for the practicum, but not for the other academic parts of the subjects
Mhm.
taught. No, here there was an integration between practice, what you were experiencing, and what you were being taught, that was absolutely unusual and extremely involving.
Mm-hmm.
A very integrated learning experience, so that your thesis was not a research thesis. Your thesis had to be the summing up of what an aspect that you'd learned in practice, that you had actually done based upon your own work.
Mm-hmm. So what was yours?
Mine was on the application to what was the title? It's over here somewhere. The application process in the Family Service Agency.
Mm-hmm.
What I learned about carrying that
Mm-hmm.
had been very meaningful to me.
Mm-hmm.
But some of the biggest learning came from some other students' material as well. When I actually a student who worked in a mental hospital and was working with people in a mental hospital, and I finally began to understand what they were talking about when they were talking about you have to understand what is the service that you're there to offer. What's being offered, not just what is the client doing over there, but what do they need from you as being the core, not just psychological insight, but psychological insight into what process, what's really going on. And when I understood the patients helping patients to try to move out of a mental hospital, and that was the job, and began to see how, when you looked at that job, what was involved, how you had to look at what you had to ask of the patient if they were going to learn to get out of the hospital, and how clear and consistent you had to be. And I began to also tie that up with what my experience had been in the school of social work. It began to all of a sudden come together for me.
Mm-hmm.
And that I began to understand a little bit more about functional social work.
Mm-hmm.
Basically something which is always, I've never hit the bottom in that. Never found that I've failed that I really bottomed out, and I couldn't learn any more about this, and there was nothing more I could do. So it's always been a challenge and an interest, but the
Mm-hmm.
direction I was given, and they never kidded. All that they said, well, we'll stand you on your feet. You don't have much skill,
Mm-hmm.
but we'll just stand you on your feet, and you have to keep on learning
The other
for
thing-
5 years at least before you.
The other thing that occurs to me that I want to check out with you about this approach is that one would always keep in mind as sort of a benchmark or some kind of a turning point, a reference point, the job of the agency. The job of the agency is to do X, and I as a worker have these skills. It seems like it enables you to put limits, very clear limits on what you can do.
Of course.
That's an important thing to be able to do. And I wonder if in other approaches that's possible, or as possible.
Well, why don't you turn it around and say what's responsible to the client? The agency offers certain services, okay? Pick any agency you want. What is it really offering to the client? Is it offering an adoption service? Is it carrying a protection service? Is it carrying an institutional service for older people? Is it carrying a daycare service? What there's there for us the service. Now, the person coming, what you really want is for the person coming, instead of just sitting back and being an object of diagnosis, and we will diagnose and then we will prescribe. You see, maybe I'm getting a little sarcastic about that, but again, you must realize the influence in social work, what social work was getting into, its interest in psychology and psychiatry and people being influenced by the medical model, and social work clearly prescribes that there are presenting symptoms. There's the presenting symptoms, there is the tentative diagnosis, there's the firm diagnosis, and then there's the treatment plan, and then there's the treatment. All a medical model. And social workers didn't have a strong social work model to follow, and considered themselves much more professional, and were accepted as professionals by certainly in the medical area, when they could use that terminology and follow it.
Can I try and make another link here?
Yeah.
Another question that comes to mind is something that social work as a profession seems to have experienced, the problem of being all things to all people, and the problem of burnout. In the kind of approach that you're suggesting, I'm wondering if that at the time anyway, was seen as a way of defining social work practice and delimiting it, which other
Well,
approaches didn't allow.
Everybody is limited in there. Everybody is limited whether they want to admit it or not. Everybody's limited. But being consciously limited on behalf of the client, that is not just limited in self-protection, but what are you going to undertake with the client? The client comes, okay? Client comes for adoption. They don't come for psychotherapy. If they wanted to go if that's what they wanted, they would go somewhere else. But the adoption process has to involve the person in thinking through whether they want to go, whether they are ready to really participate enough to enable the agency to know whether they're making a correct assessment of these people. They have to be ready to involve the people. The client has to be ready. It's the same thing in approaching institutional care, with which I'm the most familiar. A lot of times people regard the application to institutional care as, well, they have the organization, and it has various people who give a nursing assessment and a medical assessment, and they will measure the client in, define his dimensions, and see whether that client fits into the parameters of the institution. And if they fit into the parameters of the institution, then they will admit them. Okay? That's the classical way of looking at it. Well, that isn't the functional social work way of looking at it. They're much more interested in the client and helping the client to take hold of that whole application process, and take a look at that institution and see whether it is for them, and how the person takes hold of that institution, how they're looking at their problem, how they do it tells them a great deal about the client, and they use it to help the client think more clearly so that the client's making choice.
Sure.
Yeah.
What
And so
hap-
the other can turn out to be manipulation. I don't say it is, it's say it can turn out to be.
The reason I'm smiling is I'm thinking of the applicability of what you've just said about the admission process that you went through with Jesse Taft. It sounds like the same thing.
That was the point.
Yeah.
The point was that they didn't teach anything that they didn't practice.
Mm-hmm.
It was applied in that school, and sometimes you only realize it after you were out because you were so involved. But they really saw it as a real helping situation. They were there to give you and help you to use it, but they were going to gear you to what you had to do to get what you had out of it.
Right.
Yeah.
Okay, let's see, we've gone for about 45 minutes now. Do you want to continue on for another little bit and talk about your first job after school? Or do you want to stop and take a break?
Do you want a cup of coffee?
Sure, we can stop.
Okay.
Yeah. Okay, Mr. Lyons, when we left off, excuse me, you were discussing the Pennsylvania school and what you learned there. Were there other things that happened in Philadelphia that influenced your later practice as a social worker?
Yes, there was. I didn't tell you about the third course that we had. We had only 3 subjects, and the third one was social work, the professional responsibility of a social worker outside the client-worker relationship. And that was taught by Kenneth Prey, who was the dean of the school at that time. And that was focused upon what was the nature of professional responsibility. As he put it very clearly, outside the worker-client relationship, what was your professional responsibility to your agency, to your profession, to the community? And how did you carry it in a way that reflected professional rather than just unprofessional conduct? When you were relating to your agency, what was the professional way to relate to your agency? When you're relating to your community, what was your professional responsibility to the community outside of your personal responsibility to the community? And what was your professional responsibility to your association? And there was a very clear, just like there was in for practice, there was he had a very clear philosophy about that whole approach, using conflict situations, situations of conflict in which workers had felt in conflict with their agency and had felt in conflict with what was happening in the community, and how one related to one's professional association, what was one's obligation. And there was a very strong ethical responsibility developed out of in this philosophy that influenced me a great deal, so that I had no question about my responsibility to belong both to the National Association of Social Workers, which in the States, and as soon as I was here, to the Canadian Association of Social Workers. That it just was part of being a professional person. It wasn't a question of whether what was the association going to give me. I mean, we dealt with that when we were in school, and that was like grade 8. So it shocked me, and still shocks me. It doesn't shock me. I'm sorry. It shocked me at the time, but it doesn't shock me anymore, because I meet it all the time. The lack of understanding, the lack of professional commitment, the feeling that professional commitment does not include commitment to the professional association as the main expression of the profession, and it's the means through which you have to help the profession to develop. One of the main means, not the only, but one of the main means. But again, it's a reflection of what was happening in schools of social work and in the profession. It got fragmented and pulled apart in the course of its development. Certainly in the 40s, the 50s, and the 60s. People said the professional association isn't doing what it should do. Therefore, I'm not going to belong. Now, it's my responsibility to belong, whether or not it does, and to see what I could do with that association, which is what I was taught as being professional responsibility. The other was, well, I'll do my own thing. Well, I'll do my own thing as a personal, not a professional expression. There's a whole, and one wants to have one's personal commitment, that's something else. But a professional commitment is very important.
When you worked in Philadelphia for a while after you finished school, I believe you told me from 1945 to 1949, was when you were at the Jewish Family Services in Philadelphia. When you came back to Canada, how did that commitment to the profession show itself for you? What was it like in the professional association in Canada in 1949?
Well, the association reflected, of course, what was happening in politics in Canada, and has reflected what is happening in politics in Canada, because at that time you belonged to the National Association, and that had its chapters. The chapters were chapters of the national, not chapters of the provincial. And that was important to try to get some integration across Canada, which was very important. there weren't that many social workers in those days as there are today. This was the time of fewer social workers. Every social worker that graduated was guaranteed a job because there were just such a demand. So that there wasn't the problem that there is today. There weren't the services that employed. There were services, but not that many.
Mhm.
And there weren't that many schools of social work. They've proliferated since then. So that when you began in your local branch. And I began in the program committee and worked in the program committee and got onto the local chapter and became a representative to the national board. And it was at that time that the whole question of provincial associations began to ferment in the organization. And indeed, it was with the Quiet Revolution in Quebec that was one of the chief forces that was an impetus to this, because with the Quiet Revolution in Quebec, Jean Sauvé, was it Jean Sauvé? No, more. Who was the Prime Minister Sauvé? Who right after Paul Sauvé, right after Duplessis? No, it was another Sauvé. I can't remember. It doesn't matter which one, but his daughter was a social worker.
Mm-hmm.
And what they were able to do, because there was a real revolution in Quebec, was that they were able to get protection of title. But to do that, they had to have a provincial organization. And that was a big impetus. Then the national organization had to work out modus vivendi with the provincial group to keep memberships. Did you have dual membership? What did you have? And of course, the whole tendency to want to have provincial organizations that would pull, as chapters proliferated, to pull them together was on the scene. So in my tenure in the National Board, this is when it was beginning. And when in Ontario, there was a lot of concern about wanting to get licensing, which I always felt was, and it took a long time for them to find out that it was it was the wrong direction to go, because protection of title was a far better way of going, because that had developed in the United States. The United States had developed the Academy of Professional Social Workers that gave the ASCW, or ACSW, Academy of ACSW in the States, and there was a real logic to this, because licensing is a much more difficult path to follow. And in the seeking of licensing, we were chasing after a rainbow that was really rather elusive and wasting a lot of time until we got to the present state that we are now, where we have at least licensing, at least protection of title.
Mm-hmm.
And that gave us much more control. Unfortunately, I got preoccupied in my new job. I kept up contact. I kept up membership, certainly, but some of my committee responsibilities I couldn't follow through in the new jobs I undertook when I moved to Baycrest.
Mm-hmm.
When I came to Toronto, I came to Jewish Family and Child Service and became head of the Family Service Department of that organization.
That was in, what, 1949?
49, that's right.
Mhm.
For 8 years I was there.
Mm-hmm.
And that was a very interesting and absorbing experience too, because at the time that I arrived, there was the whole flood of immigrants from Europe who had been released from camps.
Yeah.
And there had been the first flood of European youth that were supposed to be had lost their parents, some of whom had not lost their parents, but the parents had, they might not have known where their parents were by that time because they had been gotten out of the country or they'd been separated. But that had preceded me. That wave had preceded me to the agency, and we were beginning then to receive families of people. That had happened as well in the States. And that was a tremendous pressure. The agency was just beside itself in trying to cope with helping these families to resettle. We were trying to work in every possible way. Hours didn't mean anything. You could just, they were ready to pay us overtime hours. We were too exhausted to work anymore. The hours we were putting in were enough. But trying to cope with numbers and trying to deal with problems of settlement of families, helping families pull together, helping to sustain people who were seeking work and learning language and had housing and so forth. Actually, some of that I had done in Philadelphia, and it served me in good stead in Toronto.
Mm-hmm.
And again, the clarity of the Pennsylvania school helped me in this a great deal because in Philadelphia, they were very much interested in, at the time, and they had a temporary shelter for people who arrived. And they wanted to move people out of the shelter quickly and get them into apartments. And actually they were pushing people too fast. And I helped them to confirm a scheme by which the people would move in stages, where they would rent a furnished apartment. Because here were people out of camps and talking about, we'll go out and we'll help you buy furniture and get an unfurnished apartment and so forth. And these people really needed to have something provided for them and find out what they really wanted in furnishings and so forth. You needed to tailor the structure so that the people could do it, and that was very useful.
And to be able to sustain themselves, or with the help of the agencies, through those periods of massive change.
Yes, well, they were economically dependent. And you had to have budgets and work out with them with budgets, and this was a whole foreign thing to some of these people. And more than that, there was a cultural conflict because to survive, some of these people had survived. If you didn't know how to manipulate, you never survived. So some of the people were not used to having people who were bargaining about what they should get and so forth, or much against the angle. You know, if you were offered something, you were supposed to be grateful.
Mm-hmm.
Well, they had much more spirit than that,
Mm-hmm.
and therefore they kept us on the mark. About the agency had financial limitations, but they were always arguing about what their need was in order to do what they needed to do. So it was a very vital, difficult situation, and there was then the settled families and the family problems that came up. There were piles of problems in families. Family problems have not disappeared or changed that drastically.
What kinds of
over
family
the-
problems were you seeing then?
The same kind of problems you see today: conflicts between parents and children, conflicts in marriage, people who were in economic difficulties because of disorganization in the families, and poor wage earner who was going in the wrong directions, and all kinds of things like this.
Mm-hmm.
And again, it was a matter of, you couldn't move in, and there's a real, what you learned at the Pennsylvania school, as you learn anywhere, and I think in a school of social workers, there's a difference between giving and helping. That's fundamental. And you have to learn how to translate that into action.
Mm-hmm.
So that there's a whole contracting that has to occur. The agency's giving, is it giving unconditionally? If it's giving on conditions, are the conditions bought by the client? What is the real contract? What is the joint purpose for what you're working, which is critical? And therefore, you have to begin with the client's purpose in coming and what they're after. And then they have to confront whether the agency's ready to support that and why not.
Mm-hmm.
So you have to reach a contract, and this is what, of course, that's involved in all forms of helping, whether it's recognized or not, whether it's analyzed that way or not. It's another question.
Yeah, as is whether or not it's articulated.
Yes.
Mm-hmm. Mm-hmm. At the time that you were doing the work at the Jewish Family and Child Services here in Toronto, particularly during those early years when the resettlement questions were so prominent, what was the involvement or response of government and other organizations?
Well, government was had opened. The government's chief function was to open up the gates and allow people in. They developed. There were agencies that were advocates of immigrants, certainly in the Jewish community and in the non-Jewish community. And gradually, the government gave more support to immigrants. But immigrants at that time had to be sponsored. And had to guarantee that they wouldn't become public charges, because if they become public charges, they couldn't get citizenship or they could be deported. So there was a terrific drain upon private funds. The degree to which you could support people determined how many people you could look after and on what level. So there was a terrific drain on private funds. Gradually, that concept that the immigrant was a burden on the community and should not be a burden on the community has gradually changed. And that was, again, one of the big program changes that occurred, where now the government will give support to immigrants to help them get and doesn't penalize them for being in that position.
Mm-hmm.
But at the time, that was one of the fears of immigrants. I mustn't send them to public welfare
Mm-hmm.
because they could be in danger.
Again, at that period of time,
You could send them to try to get jobs. That you could
Mhm.
do, but they couldn't be supported in public welfare.
Mm-hmm. Again, at that time, what other kinds of services were available within the Jewish community?
Well, there was the Jewish Immigrant Aid, there was the Jewish Vocational Service, there was health services, the Mount Sinai Hospital and other health services were available to them.
Mm-hmm.
Those were the main. It's interesting to go back. I've left it so far behind, and to recount all the services that we used, I can't recall them all.
I was going to get to that. What was the situation with child welfare for the Jewish community at that time?
Well, we had our own. It was a Jewish Family and Child Service. So in effect, the children's side of the work was operating in effect like an agent for the Children's Aid Society. It didn't have the standing of a Children's Aid Society, but for Jewish children, they were doing, by arrangement with the Children's Aid Society, what the Children's Aid Society would have done.
Mm-hmm.
Except when it came to certain legal arrangements. If there was a protection situation that was going to go to court, you had to go through the Children's Aid Society to do that.
Mm-hmm. At that time, say 1950, what services for the aged were available within the Jewish community?
Very few.
Mm-hmm.
Very few. Actually, that's one of the things that was developing and which got me interested in services to the aged, because we were developing services for the aged, and we had done one thing, and that is begun to isolate the caseload of older people, not scatter it around amongst a whole group of workers, but begin to isolate and concentrate upon it. There was an institution at that time called the Jewish Old Folks Home. They had a club that met Saturday nights in the Y, and was a social club for more well-able older people. They played cards and had danced and did things like that, but it was just a club. And there was financial support through the Jewish Family and Child Service for the special needs of older people, providing support that people couldn't get on public welfare. So there was supplemental support, sometimes for added rent or added things that the older people needed. But at that time, then we began to develop a foster home program for older people in Jewish Family and Child Service. That began very small, and we began to find people who were interested in taking older people who needed a home into their home and give them care on a fee basis. And we selected the people and paid the rent, and the people paid us what they could. And gradually that began to grow. We got more skilled at how to select people and how to support the foster home, which was absolutely critical, like it is for children. And that really was growing at the time that I moved in 1957 to Baycrest. And that influenced my whole experience in developing services to help older people and their families look at what they could do with older people. Influenced what happened at Baycrest very markedly. Because when I went to Baycrest, that institutional look at processing people was really what was happening. Baycrest had moved from Cecil Street, where it was the Jewish Old Folks Home, to its present site, where it had a hospital, where it had professional administration, and was a much more sophisticated organization, and had social workers, which the other one never had. I came as administrative assistant and director of social work, and there were one MSW who was a group worker, and one full-time social worker who was an MSW, and one part-time who was an MSW, and that was the whole staff, and myself. And when I came with a wholly different view of looking at the older person and the situation, coming from a family background, so that I put myself in order to find out what was going on, I put myself as the person who would take the phone calls. And I began to realize, I began to work with people on, an application to a home for the aged is a call for help, isn't it? It says, I got a problem, and my answer is institutionalization. Well, instead of saying, well, do you fit within the institution, my impulse was, my experience was, what's the problem? Like we did it back at the family service, what's the problem? And meeting with the older person and the whole family to look at what produced this application and to begin to factor out what are the things that are pressing, what are the pushes, what isn't good. If it's health, what's being done about health? If it's housing, what's being done about housing? If it's loneliness, what's being done about loneliness? Loneliness doesn't tell you anything. It doesn't tell you whether the older person is withdrawing or whether people are withdrawing from them, or it doesn't tell you. You got to get in and find out what's cooking. What are all the reasons that people come to apply for institutions? So if you really get the whole family and the person to look at what goes on and then what can be done about each of these problems. you're a long way from talking about institutionalization. You're talking about helping people to use their own and community resources first.
Mhm.
And that became the policy of Baycrest out of that experience. And then we tied that up with the foster home program. And we tied up, so we made referrals for foster care. And then something else developed that was a neat little operation, and that was actually from our board had heard of daycare for older people, and pushed me. I was so busy with other things I didn't want to take on anything more, but they pushed me into doing it. So we established on a small scale, we surveyed what was going on in the States in daycare. There had been a big push in daycare. It's very interesting how things develop in daycare for older people, because it really developed out of one home for the aged in Cleveland that had there were two social workers. One was the administrator and one was the social worker who handled applications.
Mhm.
And they had a problem with a woman who was in terrible conflict with her daughter and living at home. They really didn't know what to do. They didn't have any space to take her in. They decided that they would take her in, but didn't have any space. So in order to ease the conflict, they said, well, come here during the day. Now, they didn't do anything, basically, with her. They just said, you can participate in whatever is going on. But it did relieve the situation and enabled them to hold the situation until she could come in.
Mm-hmm.
Well, they were great publicists, these two, man and wife team. And Eleanor Roosevelt ran a daily column and came to town, and they got to talk with her, got introduced to her, and told her about this program because they tried it with a second person. And they realized that they had something. And so they talked about it, and she wrote it up in her national column. And Homes for the Aged, especially Jewish Homes for the Aged, where this had occurred, jumped in the bandwagon and said, let's form a daycare program. So they all got in and thought that they could establish a daycare program by offering what was going on in the home to people from the outside. That isn't the way it works. By the time we got around to find out, well, most of them had fizzled, because you're taking a person who doesn't have a base within the institution and saying participate.
Mm-hmm.
You got to have somebody, a means of helping them to get in. There's steps and means of enabling people to participate.
Mm-hmm.
So they had to have a place of their own. So we benefited from their mistakes and started ours off small and constructed it on the basis of what we learned as we went along. But starting them off with their own worker and their own place in the institution and their own program, so that they had a base within the institution.
Mm-hmm.
And so it took off like lightning. And because there was only this club for older people. So people began to apply to daycare who really needed a senior adult center, because we were the only real active program for a whole day that was going on in the Jewish community.
When you say senior adult center, is that expanded recreation facilities?
Well, a senior adult center is a center in which there's a whole smorgasbord of things going on, in which the person comes as frequently or as seldom as they want, and there's a whole choice of things in which they get involved with: educational and physical health, the whole deal.
Yeah. Okay.
And has a multiplicity of services, and which involves the older people in the running of the place and the offering of services, and begins to develop a self-help complement
Mm-hmm.
to the service, so that seniors are helping seniors.
Mm-hmm.
That's real involvement. But they didn't have anything like this at the beginning. Well, that daycare program all of a sudden began to help the foster home program, because you take a person into your home 7 days a week, 24 hours a day, something's got to give, right?
Next change.
Sure. So what happens is we found that people who are in foster homes, like an aunt of mine, could begin to wear on people's nerves. You could break up a good foster home unless you have some relief, and unless the person can. So combining it with daycare really helped to promote the foster home program and added to the daycare program. And since the staff that I had worked with there and I knew one another, and we could work out the arrangements just beautifully. For a while, we had in Toronto, in the Jewish community, the largest foster home program of any community in America, larger than where it started in New York. It started in New York because of that combination. But with changes in personnel and things, it fell apart, unfortunately.
The whole concept, just,
There was a change in administration, and there was a change in emphasis, and a change in workers, and the thing got lost. So that the program didn't, they had more difficulty, they didn't know how to deal with some of the difficulty, and there wasn't that same working together, so that the program, the daycare program, took off and grew. It was until, I don't know whether it still is, but it certainly was the largest, the most successful daycare program for older adults in America, again, in Toronto.
Not to focus on the negative at all, but I wonder if there's anything about the nature of the profession itself, about the nature of social work, that you think affected the fact that program deteriorated.
Well, I don't know that it's in the nature of not just social work, but organization. You know, to run a big organization, or a varied organization, requires a lot of professional expertise and relatedness all over the place. You don't always get that uniformity. You can have priorities. An agency has limited resources, not unlimited resources. So that where a board and an executive or an executive director feels is important to meet community need, that is got to have priority. And unless you pay attention to a service, unless you're giving a service attention, it can deteriorate. That can happen in hospitals, it happens in all. So it isn't only a reflection in social work.
Okay.
And I think it was much more community pressures, because they built up some other programs in that organization that weren't existing before. It isn't that they did less, they did different things. But
during the time that you have been at Baycrest, you've moved on from being the administrative assistant to the Department of Social Work. What position did you hold after that one?
I was the director of, that's right, I was a director of social work in Baycrest, and then became administrator of the Home for the Aged. Baycrest is made up of 5 components. A hospital, 2 homes for the aged, offering different levels of care, 1 minimal care and 1 heavy care, a daycare service, and a senior adult center. I became the administrator of the Jewish Home for the Aged and Baycrest Daycare Service. And when I took on that job, out of my experience in working at Jewish Family and Child Service, where I had worked very hard for 8 years, I'm sorry, and I felt the need for change. That's what interested me when someone asked me whether I'd be interested in the job at Baycrest. I felt the need of change, and I felt that if I stayed in a job longer than 10 years, it would be a mistake. So I gave notice when I took on the job that if they didn't fire me beforehand, I would leave that job in 10 years. Because I figured if I couldn't do what I wanted to do in 10 years, I should leave. And if I did do, I should leave anyway.
Yeah.
But it was a very wise decision.
Yeah.
So I was the administrator of those services for 10 years. And then I returned back to social work, back to the central intake service, out of that philosophy that I was telling you about in social work, about helping people to use their own and community resources. And adding to that then, if they needed institutional care, that was a very practical way of testing need. The code said that we should admit the people who needed it the most. And we developed the definition of need, which was after people had used their own and community resources, the applicant and family, and not a family representative. We looked at the whole family. That's another thing that's, I think, is important in social work. Recognizing, and I think that's recognized today, people aren't separate from one another, that whoever comes is always connected with ties of one kind or another. There's a system in there that needs to be paid attention to. But if the applicant and his whole family use their own and community resources, you would see the people who couldn't be sustained using community resources. And those people were then given a priority for admission. But the process of admission was again one of expecting the applicant and the family to really get to know what they were applying for. What was so making the institution knowable, coming to daycare was part of the whole, getting to know a little bit about programs in the institution and what the meals were like, and then getting people to really look at what was pushing them to institutional care and what would be different when they entered the institution, and what might be, so that the client is making a choice, a conscious choice, not just the institution you're admissible. Because that's the whole point in making, because otherwise you admit people at the time of vulnerability and they feel like helpless victims, and I had no choice and I had to come in, and they spend a lot of time mourning, and then they say they don't make a good adjustment. But if you can maximize this person's choice so that they, doesn't mean that coming into an institution isn't a terrible shock. It is terrible. But you minimize it if you maximize the person's own digging into the institution to try to make a life for themselves, that it's their responsibility, not just the institution's. That's helping. That's what functional casework taught me.
Okay. I'm wondering if I could move now to some
Sure.
summary questions. The first of which would be, as you look back over your career as a social worker, and I guess I should also add in your educational process, challenges that you faced over the years.
Challenges. Well, there are always challenges because most situations are a challenge on the individual level. Organizing services, such as a daycare service, such as a central intake service for Baycrest, are challenges. I think the challenge is to try to keep a balance, to try to keep your mind open, and not get overwhelmed and just in defensiveness close it off. But also to be very practical about what you can do at any one time. Trying to think that you can do everything, or that you're going to meet all kinds of human need, ends up with being irresponsible because you don't meet the need, and you got to carry the guilt for not meeting need. This is sometimes what burnout is people not having enough. I don't say that that's the only reason, don't misunderstand me, but sometimes because people aren't focused in what they're undertaking, so that they see a family problem and they want to deal with all aspects of the family problem. And when people come for help, they're very vulnerable too. People can get engaged in all kinds of things about the family. They can want to kill the social worker after for knowing so much about them, because they didn't make some choices in getting into it.
Mhm.
They can be trapped by the vulnerability. So it's very important that you, if you're going to carry responsibility in helping, that you have it limited enough, as you were suggesting, so that you can carry that responsibility. So what you undertake, you can carry through.
Mhm. Mhm.
And that's part of agency responsibility as well. And that's also what you have to feed back to agency. People, I got, I think, some very good training from Kenneth Prey in how to hold an agency responsible instead of just griping. You know, that's a very important part of learning to be a social worker. How do you hold the setting responsible for the decisions it's making? Not just by griping, but some of the things that you undertake, you say, well, I'm going to undertake it because I'm going to do more than what the agency is provided because I'm going to be the good guy. You're not necessarily helping in the end, helping clients, because you're not holding the agency responsible for continuing that service. It's all dependent upon you. It's all dependent upon you.
Mhm. Okay, just put that back a little,
Yeah.
excuse me.
You'll
Lost it.
click and click and click until popping out. Okay.
So, the idea about, not only personal, not personal, individual accountability, but agency accountability.
Well, the two go together. Yeah, see, in the way I understand social work, the two are not separate. There's no such thing as being able to be an accountable social work without an accountable agency, and without a mutual sense of accountability, you're in an unprofessional situation. The agency has to be accountable to support the work, not just in pay. Has to be accountable to deal with some of the repercussions that come from what you're dealing with clients, and you've got to help the agency to do it. Learning to help the agency to do it, the people above you, to do it is very important. How you bring information, how you prepare and help them to see the consequences of what's happening down in the firing line is important, and how people are able to help the community to take responsibility. We had a very good experience with that around the whole question of campaigning for health insurance, which the CASW social workers were very active in my time, because there was the whole debate about publicly financed health insurance, which we accept so easily today. There was a commission that was hearing, and one of the most effective pieces of public interpretation which I've ever been privileged to listen to, actually, was presented by asking members of the commission to come to a special CASW meeting in which 3 social workers just told stories. One from a family agency, a children's agency, and what was the third? I think, oh yes, a hospital. And they just told the stories of how, without support, families that had been functioning were wrecked and pulled apart. They just told facts. They didn't identify, but they just told what had happened around the bearing of health costs. And they were told by the commission that that was one of the best presentations they had heard in the months of hearings that they had had.
Mm-hmm.
Now
Yeah.
that was a very effective piece of interpretation.
Mm-hmm. Indeed. So the challenges then, you've mentioned a number of them. I wonder if you also have some thoughts about your accomplishments during your years as a social worker.
Well, I guess it was an accomplishment that I stayed interested in social work and survived. Actually, I've enjoyed social work with all the pressures. I've never regretted being a social worker. There were, well, that isn't wholly the way things work, because at times your understanding and your skill are not sufficient for the situation. And at those times, I felt that I should drop out of social work and be a carpenter, There were certain things that you could learn to do with wood that were regular, and people were too complicated, and I didn't know enough about how to handle situations. So, but you know, they weren't that long-lived. That I did get out. So I don't want to make it a rosy picture. It was damned hard work, and without the dedication, I don't think you learn enough. You don't learn without the commitment. You have to care a great deal, and if you don't care and it's beginning to get to you, then the best thing to do is to get out and either get refreshed or do something else, go and do research.
Other accomplishments you care to mention?
Well, building up services that worked, building up services in Jewish Family and Child Service, helping students to learn, seeing that they learned, seeing what they did with the learning. Those are all sources of satisfaction. Seeing that what you understood could be transmitted, that you could learn how to transmit it. Seeing people take it and use it and develop on it, that's a great source of satisfaction. Those are the main ones. I think that there are always fringe benefits, people you meet, experiences that enrich you, and clients that make you feel humble. Because if you're going to be a social worker worth anything, you're going to see people who can do what you couldn't do, that have borne and struggled with difficulties against odds that you don't think you could cope with at all. And if you can't respect that and care for how they're trying, it's not good enough. You got to try. And then there's the pain. You got to be able to bear pain, because you do things that are wrong. I can still think of things that I did in my early years, and I would like to crawl into a hole in embarrassment and pain about what I didn't do, what I didn't know. Because people are very vulnerable and very dependent upon you, and if you don't help, you're going to suffer. And if you don't want to suffer, don't be in social work, because that comes with the territory. If you don't care, you won't suffer. And if you do care, you're going to suffer. But just suffering alone isn't going to do it. You got to learn, what can I learn from that to do it better next time?
Okay. I wonder if, in conclusion, there's something that you'd like to add, anything you'd like to talk about that I haven't asked, or closing thoughts or anything like that?
No, I think it is important for the professional association to somewhere in this whole scene of social work, we've got to begin to stop. I worry about social work becoming a whole bunch of gimmicks. You know, you have a technique for this and a technique for that, and you're supposed to be armored with an armatorium of techniques that you pull out, which I think I find students are excellent students, caring people, bright, able. I find them that the social work education itself hasn't pulled together a consistent enough philosophy that's put into practice. It's like the schools of social work are trying to produce products that can do everything. Like you can do research. You know, research in social work, I think there's a good deal that social work has to rethink the whole matter of its role in research. Because there are people from whom social workers have learned and will continue to learn, who are excellent at social research. And all the techniques and all the techniques that go with making good research. And I don't think that's the role of social workers in research. I think that social workers in research, for example, have a contribution to make as using research as a helping tool. Because research is an intervention. And if research doesn't leave the organization that uses it stronger and more able to cope after its research, then I don't care what they call the quality of the final products and the tables and how good the how sound they think their conclusions are. I don't think that's good use. I don't think social workers belong in that. I think social workers belong in looking at the process by which organizations use research that help them to strengthen themselves, which is very consistent with what is the helping process with individuals and families. After all, it isn't what the social worker ends up knowing in his head about this, how well he can write up the case, and not that that isn't important, but it's what is left in people's hands, what they can do as a result of that contact, how what they can take and use in their own lives and do something with their life differently or better, or at least to preserve themselves, that they couldn't do before. That's the final and acid test of helping. And that same test, I think, applies in research as it applies in group work, working with groups of people and so forth. And I think there's something about the overall philosophy of social work that's been fragmented because of the pressures of that I've mentioned about what happens in schools of social work, which are a social institution. You know, it's one thing for me to be very critical and say schools should do this and schools should do that, but it is a social institution, and it has all the pressures, financial and social and egotistical, personal pressures. You know, you get a position as a professor, and as a professor in a university, you can decide the way you're going to teach things. It creates huge problems in getting an integrated program for students who come to social work, deciding what of all of this really is the core of what we have to teach, and what is periphery, and what can we teach within 1 year? What is the student really able to learn? Some of these challenges face the professional and the professional organization as well as schools of social work. They face the profession because we can be scattered all over the place. Social workers have felt, unless I'm a therapist, unless I can attach therapy to the word, it isn't, to my work, it isn't any good. Not that social work hasn't been therapeutic. There's a difference between therapeutic, things being therapeutic and things being therapy. Therapy is a function. It isn't necessarily social function. Not that, I don't want to get into that controversy. It can be. That's where I feel that private practice is indeed a private practice of therapy. But what's social about private practice is another question. And I really do think the social basis for social work, the social organization that sponsors it and its function, is a key foundation, and that there has to be some organizing. We have to get together and argue over the organizing principle and begin to get back to some basics that I think we've lost. It's always easy to say because somebody is old, and maybe they say you're not up to date in theories and so forth, that, well, you know, that's old stuff. If old people want to retreat. But not all things that were in the past were that bad. We were able to help people significantly. And even with some of the limitations we had, I think students are better educated and start off with much better education. Any graduate from the Toronto School of Social Work is head and shoulders in education above where I was. No question at all.
So, one of the things that struck me about our conversation this afternoon is the extent to which helping is the basis, appears to be the basis of social work, no matter how it's practiced. That it's the root,
I don't think it has any validity outside of that. That's its function, whether it's helping on the community level. I think when the people talk about advocacy and they don't talk about it within the helping context, I think it doesn't belong in social work. There are people who are great advocates, and social work didn't invent advocacy, you know. But I think we've learned something about social processes, and we're obligated as professionals. We can operate non-professionally. That's okay. I'm not saying that we don't have an obligation. Kenneth Pray felt it was his obligation to be politically active. He
Mhm.
always campaigned in political, he would choose the candidates he would support based upon what he thought they would do in the social program, and he said that was important. I'm exercising not only my citizens' rights, but also what I think is a professional responsibility, as well as being active in other organizations.
Right.
No, I don't think that you separate the two. I think that's an absolute disaster to the profession.
Mm-hmm.
That it's the helping is the organizing core of what gives it validity.
Mm-hmm. Okay. Well, in conclusion then, I'd like to thank you very much for your time this afternoon and for sharing your thoughts with us, with me and with Simon and with whoever will be seeing this material. The other thing that I'd like to say is that I think that the way in which you've approached our meeting today and the philosophical content of it will help keep alive, if not renew, the discussion about the basis of social work, about what the profession is about. And for that, too, I appreciate what you said.
Thank you.
Thanks.
Okay. More coffee?
No, thanks.
You want anything with your coffee?
No. Really, I enjoyed it, Mr. Lyons. My social work education, I think, was, we didn't talk much about philosophy, although we didn't have time. I was at the University of Michigan, and as I remember in my class, there was 600 people.